happy to have Deborah Schindele with us today. She'll be sharing ketamine-assisted spiritual psychedelic psychotherapy. We're so happy to have you. Deborah's journey started when she left home for college at 16 to escape a challenging family of origin. And she discovered psychedelics at that time, and they saved her life. In 1986, she completed a PhD in organic chemistry and a postdoctoral research fellowship in chemistry at the University of Washington. In 1995, she ran a biotech company when a birth trauma rendered her unable to walk, sit normally, or control body functions. This led her to shift focus toward mind-body medicine, as only so much traditional Western medicine and surgery could repair. In service to healing, she moved to the island of Maui, earned a master's degree in spiritual or transpersonal psychology, became a personal trainer, studied almost every known alternative approach to healing, including hypnosis, breathwork, meditation, yoga, energy medicine, and sound healing, and received many forms of treatment: TCM, acupuncture, craniosacral therapy. It took some years, but eventually she regained her health, healed the trauma. As she felt she had something useful to be able to help others, she was inspired to create a mind-body healing corporation, and that's called Paradise Mind and Body in 2005. Years later, she became a duly certified family and psychiatric mental health nurse practitioner. This enabled her to add to the medical piece. She also trained in many traditional forms of psychotherapy and some newer approaches that are particularly useful for trauma work. So I really appreciate you sharing your journey and your training. And we're delighted to have you.
Thank you so much for having me. And I'm going to go ahead and screen share if that's okay with you. Let's see if I can get this.
Mm. Mm.
Slides. And today I just want to say good morning. First of all, thank you so much for having me. I currently run a practice in Sedona, Arizona, and I'm also working at another practice where I serve as the director of psychedelic services. I'm all about psychedelics, and today I just wanted to focus on ketamine. But before I did, I wanted to take the opportunity just to say a deep level of gratitude and appreciation to Hedi Haj, who is the one who initially told me about this and suggested that I join to share. Um, I've known her for more than 25 years. She's been another mother to my children, a dear friend and a guide. I call her my gratitude and appreciation guru because she is an absolute master at that, demonstrates and models that in every single day life. And I've learned so much from her. And I give thanks to you every day for being in my life. Thank you, Hedia. I have a clinic in Sedona, Arizona. This isn't the view from my house. I look instead at something called Thunder Mountain, Gray Mountain, but it's a beautiful spot. And got a little bit of my history. But basically, I'll just say I'm basically a medicine woman. I don't know how else to put it. I've just discovered that that is truly my calling. And my journey with psychedelics, as was indicated, started more than 50 years ago when I left home. I had to get out. It was terrible. I needed escape. And in the words of one of my dear friends, a Theravada nun, my parents were less than skillful at parenting, as many parents were. I don't believe that anybody comes into this world and destines themselves to be poor parents. I think it happens because there's not a lot of modeling of good parenting in this world. And on a lark, I tried LSD at 16, and my life was forever changed. I believe much for the better. So I worked with pretty much every psychedelic known back then. as well as MDMA. At the time I was working with it, I was a chemist and we could synthesize that it was still legal. And again, I just learned so much about how to love and trust from that medicine. People will know it as ecstasy or Molly on the street, but it's MDMA, methylene dioxymethamphetamine, and also, like I said, a lot of other psychedelics, psilocybin, mescaline in the form of peyote, etc. Well, when I first heard about the idea of ketamine being a psychedelic, I went, "What? I don't think so." I always knew it as originally it started out being used extensively in veterinary medicine. And again, I kind of thought of it initially as more or less a horse tranquilizer, even though as a nurse, I had used it in the emergency room. It is used when a child comes in and needs a bone set, like an arm, something like that is often used as a dissociative anesthetic for that purpose. So I just never thought of it as a psychedelic. But as life will be, I really needed to open my mind a lot more. And I've engaged in many different psychedelic trainings over the years, Synthesis, Fluence, California Institute of Integral Studies, Integrative Psychiatric Institute, many different trainings in order to gain a really strong didactic knowledge of psychedelics and also become incredibly familiar with what's been done in terms of clinical trial work in the more recent past. In the 50s, 60s, and 70s, there were a tremendous amount of studies done with the psychedelics, and they basically got shelved when everything became scheduled back to a Schedule 1 or into a Schedule 1 category, which means you really can't use it without a special license to do so. Like I said, I just needed to open my mind and really see a little bit more about ketamine was about. And as I gained personal, didactic, and experiential knowledge, I became very curious about this medicine. And why would that be? First of all, my first rule of thumb is do no harm, ahimsa. And so ketamine, when it is used properly, and I'm not talking about somebody using it recreationally on the street, not doing a Matthew Perry, nothing like that. I'm talking about using it appropriately. I do it in a legal capacity in a psychiatric clinic setting. It's incredibly effective, and it's also very, very safe when used properly. I've had patients who had been living in hell for years. For example, somebody who'd been in the military, who became a sheriff, so worked as a first responder in police work, who he didn't tell me until months later that he was going to go home and blow his brains out that night. He was at his wit's end. He'd been living in hopelessness for years. And with a single infusion, he told me for the very first time, this is the first time I've had hope in years. So in one infusion, it turned him from being somebody who was profoundly suicidal to somebody who was like, okay, I think I want to live and I have hope now. That is not the experience that every person has. Everybody has a different experience, as with every psychedelic, but it's a very potent drug for reversing suicidality, treating resistant depression, anxiety, PTSD, OCD, eating disorders. I've seen people cured of eating disorders, and that is the most deadly psychiatric condition. So quite a useful medicine when used properly. But it's not a panacea. Nothing is. You still got to put in the work. Same thing is true with any psychedelic. You can have the journey, but you actually have to put in the work and integrate the material that you discover. And that's why I combine it with psychotherapy. I hold the hand of the patient. Every single patient that I see that I take on a ketamine journey, I hold their hands throughout the entire process. I'm medically monitoring throughout the process, but I'm also holding space for them, keeping them safe, and letting them know that there's someone right there with them and they can let go and they can trust and do their journey. So ketamine is a spark. It's a catalyst. It's a facilitator. It's not a panacea. And I'm so thankful that all of you shared about your psychedelic journeys today because I had no idea how this was going to go over. And I'm so pleased that you mentioned many of my personal favorites. And the fact that you were so open and sharing about your experiences made me feel oh so much more comfortable about what I was going to share. So thank you for that too. So psychedelics are psyche, mind, delia, manifesting. So they're mind manifesting medicines. And in the words of Humphrey Osborne, to fathom hell or soar angelic, take a pinch of psychedelic. You never know what you're going to get with a psychedelic. It's like a box of Cracker Jacks. You can set an intention. You could have the intention to have a beautiful journey. And some people have beautiful journeys. Some people have challenging journeys. Sometimes it's a combination of the two. There have been many, many, many famous psychonauts. Kary Mullis is the guy that discovered polymerase chain reaction, which we use extensively in biotechnology. Um, Also, Steve Jobs used it. Bill W., that's how he actually got off of alcohol. It was not 12 steps, just by the by. So psychedelic therapy is substances, psychedelic substances like ayahuasca, ibogaine, ketamine, MDMA, LSD, 5-MeO-DMT, the toad, mescaline, psilocybin, and many others that are utilized in actual psychotherapy work. All of these produce non-ordinary states of consciousness. The therapy is extraordinarily different. It's very oftentimes transpersonal, spiritual, depth psychology sort of therapy, but it's also inner directed by the patient or the facilitator. So it's guided by their inner healer, their inner wisdom, their inner guide. So it's a very non-directive form of psychotherapy, very different from when you go to a traditional psychotherapist and you do CBT or EMDR, or any of the other more traditional therapies. Well, I started out my role going into biotech. I helped develop a drug called Cialis at one point as a chem geek. I looked for a picture of myself way back then. I couldn't find it, so I used this gentleman as a representative of me being a total geek. Yes, I made everything you can possibly imagine. And while working in biotech, I helped develop some diagnostic tests for the military for drugs of abuse. And this was back in the 80s and the 90s. So I made analogs to pretty much every drug of abuse. So those are all the Schedule 1 drugs, and many of them included the psychedelics. So I have an extensive history of synthesis with those as well. So what are these psychedelic substances? Well, ayahuasca is an example of one, and you can see the structure of DMT, dimethyltryptamine, shown here on this slide. An ayahuasca brew is made from a vine and a combination of leaves. The vine itself contains MAOI, which are monooxidase inhibitors, basically, which prevent the breakdown of DMT. That's why people can trip on it. And the leaves are actually the source of the DMT. And different people actually use different brews, but this is the most common brew known. The structure of DMT is shown on the upper right. And if you just take note of, even if you're not a chemist, it doesn't matter, you can see this 6-member ring attached to a 5-member ring with a nitrogen in it. That's called an indole. And it has a side chain hanging off of it with the nitrogen and 2 methyl groups. That is DMT, dimethyltryptamine. And the really amazing thing about this particular molecule is it's very closely related in structure to serotonin, and you can see serotonin below. And it is in fact the study of psychedelic substances that led to our true knowledge of receptors that are utilized in psychopharmacology today. Well, an ayahuasca trip is oftentimes pretty much a pretty mystical experience, lasting, depending on what's in your stomach, depending on how you purge. If you do purge, it is a purgative. Around 4 to 6 hours, that's assuming a single dose. And it's been used by the peoples of the Amazon ceremonial for thousands of years. It is very useful and has been studied in clinical trials for depression, anxiety, and PTSD. And so we know it can be beneficial for these particular applications. This is ibogaine. Ibogaine, once again, if you look carefully, you'll see that six-member ring with a 5-member ring and the nitrogen attached to it. Again, this has a lot of lettuce. I call the extra stuff on it the lettuce. It's got still that 2-carbon chain and the nitrogen hanging off of it. But if you look carefully, you'll find embedded in it a very similar structure to dimethyltryptamine. And the really interesting thing about ibogaine, which is made from the boga tree, the bark of the boga tree, which comes from Gabon or Cameroon, is it's an incredibly long trip. It can be up to for some people up to 36 hours. It also has a lot of cardiovascular side effects. And so generally speaking, if it's a material that you want to use, then you can go to Mexico and use it, I'll say more or less legally. Places in Tijuana, in Cancun, and other places offer this therapy. Incredibly valuable and useful for substance use disorder, particularly opioid use disorder. And even the state of Kentucky is studying it extensively because they have a terrible opioid problem. They're either number 1 or 2 in terms of opioid abuse in this country. Well, LSD similarly has that same structure, 6-member ring, 5-member ring, that's the 2-carbon chain off it with the nitrogen, but it's got a lot of extra lettuce. And so LSD was used extensively. I mean, Cary Grant talked about it, using it openly and freely back in the 60s, basically. Bill W. used it to get off of alcohol. It was very commonly used for alcohol use disorder back then, and now it's being studied once again for that particular indication as well as for anxiety. A recent clinical trial, one single dose basically relieved people of anxiety. It is a pretty long trip. I'm going to say on the average around 10 hours. And it is very, very, very potent. Um, the first person, Albert Hoffman, that was in Europe, first stumbled across this. He got some on his fingers and kind of tripped his brains out. And the next day tried a dose that he thought was appropriate given his pharmaceutical sort of history and background, really used to taking drugs in the milligram quantity between, let's just say, 1 and 100 milligrams, maybe for a drug, depending on the drug. So he took it at that dose and tripped his brains out because LSD is extraordinarily potent at a very, very low dose, on the order of about 100 micrograms, so a thousandth of what he was taking. And even somebody like Chris Bache, who did 73 trips over the course of 20 or 23 years, I think it was, um, he was taking 500 micrograms, which is a whopper dose of LSD. It is, again, something that's quite mystical. And the reason that people put it on paper and serve it as a little tab on paper, basically a hit, is because it is so potent. So you make a diluted solution, put it on the paper, and give somebody that so you can control the dosing a lot more effectively. So going to a totally different substance, MDMA, which is considered a psychedelic, again, about a 4 to 6 hour journey. It's a derivative of amphetamine. So it's got a totally different structure. The structure of amphetamine shown on the top left, the structure of MDMA, 3,4-methylene dioxymethamphetamine, is shown on the bottom right. And if you look at it really carefully, you'll see it looks a lot like methamphetamine, but it's got these 2 oxygens hanging off this ring, and they're kind of pinned back. That turns out to be exceedingly important, I believe, in producing the effects of MDMA. Ecstasy, Molly, you might know it as, the street name for this. It also still has that similar side chain to amphetamine, but with some methyl groups on it. So if you look at a spectrum of psychedelics, where I would put MDA at one end of the spectrum, so it's definitely more of a heart opener. Most people experience euphoria, total love and acceptance of self. Historically, it was used extensively for couples therapy, and I believe it is the most effective means of affecting a change in couples that are stuck. I think about 80% of couples that are ready for divorce would not get divorced if they did a session with MDMA, which is not legal in this country at this time. We hoped it would become legalized back in August, but it didn't pass muster with the FDA, so it is not yet legal. It has been used incredibly huge amount for PTSD and is incredibly effective in the phase 3 clinical trials. Approximately 70% of people who've been diagnosed with PTSD for an average of 15 years and taken every drug and done every therapy, after they did 3 sessions with MDMA, could no longer be diagnosed with PTSD. Given that 22, perhaps closer to 40 vets commit suicide a day, and the fact that we've had this drug and known about it since the 70s and we're not using it for this, to me, I believe is quite a tragedy. So just think of how many lives possibly could have been saved, because most people that commit suicide that are veterans do so because of PTSD, which leads to substance abuse disorders and lots of other problems. So again, talking about the spectrum of psychedelics, MDMA sits at one end, being a real heart opener. LSD, psilocybin, and I'm going to put ayahuasca kind of in that category, also sit at the other end, much more of a mystical sort of experience, sort of drug. Another drug in the psychedelic category, doesn't seem to want to change slides. I'm not really sure why. Let's try. Okay, is mescaline. Again, a relatively long trip. And if you look at the structure really carefully, you'll see those same oxygens hanging off that 6-member ring. They're not pinned back in this case, but it has a lot of similarity to the structure of MDMA. And what you'll find with mescaline is it kind of sits on the spectrum of psychedelics, one end being MDMA, the other being the true say, more classical psychedelics. In the middle, it's more of a heart opener plus a mystical sort of drug. Most commonly, it's been taken or derived from peyote buttons, and I show you peyote buttons being held in the hand of an individual down on the bottom there. I have a big X in front of it, though, because Native Americans have used peyote in sacred ceremony for hundreds of years. And at this point, it's kind of sometimes difficult to get peyote. It takes 15 years to grow the buttons, and people are over harvesting it. And so it's been asked, please don't use mescaline derived from peyote. You save that for Native American ceremony now and choose a different cactus. You can use San Pedro or Wachuma and brew it from that so that we don't deplete the sources of Native American utilized mescaline. Moving on to my personal favorite, the toad. Matter of fact, my bracelet has a toad on it. And this is not how the toad, the Bufalvarius, the Sonoran desert toad, looks in real life. Somebody's taken artistic license with it and painted it. Probably, I hope, the CGI method, not for realsies, with psychedelic paint. It's a toad that lives in the desert. Tucson is a great source of it. Other places in the desert, another source of where this toad lives. They bury underground, and during the rainy season, which is typically monsoon season over the summer, they come out. People oftentimes will collect the toad. They will express the venom from its glands, and they will collect on a piece of glass that expressed venom, dry it out, scrape it, and then most often it is smoked, although it can be used through injection. And a company called Usona, which is in Madison, Wisconsin, which was started by a biotech pioneer who made billions and then is using his now billions created with that to work in psychedelics. He is the good manufacturing practice site for the vast majority of psilocybin that is used throughout the world for clinical trials, but also for 5-MeO-DMT, which is being studied extensively for a lot of different conditions. And one of the real attractive things about 5-MeO-DMT is the trip lasts about 15 minutes. So it's a really quick trip. And for most people, it is a rocket launch to God. People call it the God molecule. And if you look at it really carefully, you'll see once again that exact same structure that's common to DMT, that 6-member ring, 5-member ring, and it has the methoxy off to the sides. It's real similar in structure to DMT. It just has the OME, O-methyl group off to the side there. So one of the really interesting things about DMT, 5-MeO-DMT, is that 95% of people on average will have a mystical experience with that. That's one of the reasons I'm a real fan of it. And I actually go to Mexico to treat people with psychedelics so I can do it in a legal fashion because I got a lot of licenses behind me. But one of the cautions is that people have not been prepared for that journey and they have a very massively mystical experience where they enter into the void and then they end up on the other side having an experience of all is one in God. It can really wreak havoc with their basic belief structures. So their beliefs can kind of go out the window. What they thought God was can go out the window. All the things that have sort of been their underpinnings for their own understanding of who they are, their purpose, everything else can really be altered dramatically in a very brief period of time. And if they're not prepared to deal with that and shift their life accordingly, it can create or provoke a spiritual crisis or a spiritual emergency. And so as a result, just again, to be used with caution, definitely, and screening people ahead of time to make sure that they've got the support structures and they're prepared in the event that things shift really dramatically to deal with whatever happens. The psilocybin is another psychedelic substance. Most people get it from psilocybin-containing mushrooms, such as the cubensis mushroom, golden teachers, Venus envy, any of those sorts of strains of that particular species, or even from Amanita, which is a little bit different. It's the one that everybody's very familiar with, and most little people have clothing and artwork and all kinds of stuff. The red tops with the white little circles on it, those are the Amanita mushrooms. And once again, you'll see the structure of this very similar to DMT. So it's identical to DMT, but with a phosphate group hanging off of the 6-member ring. And it is that phosphate group that's clipped from psilocybin, creating psilocin, which is the active ingredient. And so some people experience a little bit of GI distress from that. The trip lasts about 4 to 6 hours, usually pretty mystical, full of hallucinations and other sort of alternative, non-ordinary experiences. But some people soak it in lemon juice to hopefully affect that transformation prior to ingesting it so that they get a little bit of less stomach upset, and that's already that part of the puzzle, or that piece of the puzzle has been handled before they take a trip. Psilocybin has been studied exclusively in clinical trials, a couple of phase 3s. One particularly from 2016 was utilized with people with life-threatening illnesses who had a tremendous amount of anxiety, depression, existential crisis, terrified of dying. Around 70%, 60, high 60s, 70% of people came out of that experience with having no fear of death. Their quality of life improved dramatically because they recognized, oh my gosh, I'm an eternal being. This isn't the end. Guess what? I can just let go and relax and enjoy life. So all of these drugs produce a non-ordinary state of consciousness, which is a very highly altered state of consciousness, which can be spontaneously occurring or can be induced. And it can be induced in so many different ways. And a lot of you alluded to the fact that you've never done psychedelics, but I'm sure you've had a non-ordinary state of consciousness experience because it can be occurring with chanting. I chant and lead kirtan. Obviously, that is one way to get there. I floated in a depredation tank for every single day for years, and that's another way to get there. Flow state that some people experience, or meditation, nature, somebody alluded to that today, sweat lodge, vision quest, or certainly with psychedelics. So there are many different ways that you can approach this. So somebody like Chris Pace, who talks about LSD in the mind of the universe, who I mentioned had done 73 trips over the course of about 20 years with a very high dose of LSD. His wife is a psychotherapist. She's never taken a psychedelic. She gets there by meditation and her particular means. So because when we enter into a non-ordinary state of consciousness, we're not in our straight right minds. Ethics, having incredibly potent ethics, is absolutely essential in working in this field. There have been some people in clinical trials and other places who have crossed lines, crossed boundaries, because something like MDMA, the person who's taking it enters into a total love state, oftentimes will fall in love with the facilitator that's with them. And some people have taken advantage of that and actually physically taken advantage of people. So you have to have incredibly good and clear boundaries when you work with these medicines and with people. You have to have a good consent. Make sure you know exactly, they know what's going to come, and have things explained to them. As somebody explained about their oncologist, I worked in cancer care, mostly breast cancer patients. I am a survivor. I worked there for years. And a lot of providers are not that good at explaining, this is what we're going to do, this is why we're going to do it, and let you get all your questions answered. The same is true in psychedelics. You need to have a really good consent. And you also need to have a strong agreement about touch. This part of your anatomy, so from your basically chest all the way down to your upper thighs, your knees, total no-fly zone. But it is very important to get a consent for touch because, like I say, I hold people's hands throughout the entire experience. So get consent. Can I hold your hand? Can I touch your forearm? Can I touch your shoulder during the journey that you're going to be having? And I do that with every single session. A lot of people have been physically abused in this lifetime. And by having an opportunity to be with someone that asks them every single time we're going to have a journey, do I have your permission to be touched? Your hand, your forearm, or your shoulder during this experience? May I hold your hand during this experience? It gives them an opportunity to say every single time they have that experience, yes or no. And throughout their life, most of the time, they've never had that opportunity to be asked and be able to give permission. So it's incredibly healing for people in that way. And every single time, anybody is always allowed to withdraw consent. If they get to the point where they're ready to do a journey with me, for example, with ketamine, and they say, nope, I don't want to do it, that's all bets are off. We're done. I will never provide somebody with a journey if I don't have full consent, even if they've prior consented. It has to be consent on the day of the journey. Well, ketamine is a whole different animal. It doesn't look anything like any of those other drugs. It is a dissociative anesthetic. It's actually a derivative of PCP, which is also known as angel dust. They actually used PCP way back when. They wanted to develop as a pharmaceutical, but people oftentimes when they use PCP, whether they smoke it or ingest it in another way, will have a psychotic experience. I certainly taken care of a lot of those patients in the ICU, unfortunately, and it can be very profoundly altering in an adverse way. And so they tweaked with the structure of PCP and came up with ketamine. And It's an amazing medicine. So there's a man named John Lilly who did a lot of work, cetacean work. I actually went to his funeral on Maui. I lived on Maui for years. He used ketamine extensively, and he was injecting 50 milligrams an hour every hour for weeks and weeks and weeks. So he has quite a bit of experience with it. People actually got concerned with him being a bit of a ketamine addict because of that. But he calls it something that allows you to be a peeping Tom at the keyhole of eternity. And I think that's a pretty good description of what ketamine does in terms of a psychedelic state. But that's all dependent on an individual, set setting, dose, etc. And also the graphics that are shown here are sort of matrix-like and a little bit more geometric. That is more my experience with ketamine, different sort of graphics or visuals than you would get with the other more classical psychedelics. Well, it was first approved as an anesthetic in 1970. It was used extensively in the Vietnam War era. It's carried by medics, and it is the origination of the phrase K-hole. A lot of people who use ketamine recreationally now talk about, oh, I got in a K-hole on Friday night, I took too much ketamine, which means it's a pretty profoundly altered state. But in Vietnam, when people were going to be shipped out, a lot of times they were put into trenches to keep them safe from sniper fire. And a lot of times were given ketamine, and that is where the phrase originated from. So in the process of using it as an anesthetic, it was discovered that it had some antidepressant effects. And native ketamine comes as a racemic mixture, which means it's a mixture of two different molecules that are mirror images of one another. And that is the cheapest form of ketamine by far. In 2019, a company named Janssen got approval for one enantiomer, which means one of those mirror image molecules for use in depression. They were allowed to patent it because it was just one of the molecules. Ketamine as a racemic mixture is not patentable. It's been used for years. So no pharmaceutical company is ever going to do clinical trial work probably with ketamine because of that, because there's no money in it. But they enable themselves to get money from it by having it be just one of the stereoisomers. And it's about $600 to $800 for every treatment with S-ketamine, which is also known as Spravato. It's inhaled nasal formulation of ketamine, again approved for treatment-resistant depression, suicidality, and also more recently, you no longer have to use it with an SSRI. Typically, it was having to be used with a continued dose of SSRI for its original approval indication. So as a result of the fact that ketamine as its racemic mixture is not patentable, it is used off-label because it's never been the subject of a clinical trial to prove its efficacy for depression and anxiety and other things, although there are now hundreds of thousands of publications on it for that particular use. And it is used in this way, this off-label way, so not FDA approved for these indications for suicidality, depression, anxiety, PTSD, OCD, eating disorders, dissociative identity disorders, pain control, lots of different things. And an off-label use is very common in prescribing. So for example, somebody who might be taking Ozempic and they're not taking it for purposes of treatment of diabetes, but they're taking it for weight loss, that is an off-label use of Ozempic, because so far it hasn't really been, those drugs haven't really been extensively approved for weight loss. They will very soon. That's coming. So ketamine is a Schedule 3 drug. And yes, you can get addicted to ketamine. It's not very common, especially used in a medical setting, but somebody like Matthew Perry was definitely addicted to ketamine. And by Schedule 3, I mean that it is federally required that you have to have a DEA license. You have to be able to utilize this drug in that particular way with your license. And it's different from Schedule 1 drugs. So all of the traditional classical psychedelics are Schedule 1 drugs. Heroin is a Schedule 1 drug. These are drugs that are designated as having absolutely no medical value and highly addictive. Now, I just asked the question, if you think about LSD being a Schedule 1 drug or psilocybin being a Schedule 1 drug, do you feel that schedule like a LSD or psilocybin is a highly addictive drug compared to alcohol or tobacco or opioids? I say not at all. I don't know anybody who takes LSD every day and is addicted to LSD, but I suppose it's possible. And also of no medical value, we know that these drugs have incredible medical value, but this started back in the war on drugs, back in Nixon era. And unfortunately, these drugs are still Schedule 1. So Even for people who are at end of life and with the Right to Try Act, which was fully approved in 2018, they should be able to use anything that's gone through a phase 1 clinical trial. And all of these psychedelics have been through at least a phase 1 clinical trial. But because they're Schedule 1, there's muddiness in the water about whether or not a provider that offers these medicines under that Right to Try Act or whatever umbrella, whether or not that's actually okay to do because of the illegal nature of Schedule 1 drugs. So it makes things a little bit complicated. So ketamine has a lot of different mechanisms of action. It affects learning by the glutamate system. It affects reward through the dopamine system. It acts somewhat like an opioid in that it can definitely have analgesia and euphoria. It also is anti-inflammatory through the signal 1 transduction pathway. It is given in very many different ways, lots of different routes. It can be given orally as a little troche, which is like this sort of waxy little square that's made by a compounded pharmacy with a very specific dose. It can be flavored strawberry, mint, lemon. I just tell you, doesn't matter what flavor you get. It tastes like crap. It is incredibly bitter to most people's tongue. And so when you do it as an oral formulation, usually you put it in the buccal space under the tongue, you macerate it so it becomes sort of like all the tiny little pieces or becomes almost a liquid, and you swish it like this for about 15 minutes and it will take full effect. And then you spit it out because the metabolites can be kind of upsetting to the stomach and also have a lot of variability in terms of their duration of effect. So that is how it is usually utilized when it's done orally or sublingually. It has very poor bioavailability in this form, so 20 to 50%, and I'm going to say closer to 20% personally. And so that is one way that is utilized. The nasal formulation, which can be done again as a compounded sort of thing, or as Spravato, which is an inhaled form, you shoot it up somebody's nose. It's about 40% bioavailable. It doesn't taste good. It tends to drip down the back of your throat. And again, about 40% bioavailable. So it's not that great in terms of delivery. It can also be injected, and it can be injected into a muscle. And so this picture shows the shoulder muscle, the deltoid muscle, anterior, lateral, and posterior head. And it is very bioavailable as an intramuscular injection. So about 95% comes on in about 3 to 10 minutes, lasts approximately 40 to 60 minutes. Similarly, IV has about the same onset and the same length of the duration of activity, but it is 100% bioavailable, as are other drugs that are injected parenterally. So low doses of ketamine are utilized for what's called psycholytic therapy. So any of you who are psychotherapists might be using it this way in collaboration with a provider. And that's very low dose. It doesn't produce a non-ordinary state of consciousness at that very low dose, but it opens up the window of tolerance. So people that are dealing with traumatic material, oftentimes they'll be in a psychotherapeutic session, they bring up the therapeutic or the traumatic material, you'll get a fight or flight sort of response, and they get hyper aroused. And if it goes too far, they may end up even in hypo arousal, which is like a playing possum sort of state, kind of like you can give them 8 milligrams of morphine. And so by giving somebody a very low dose of ketamine, it opens up that window. And so you can do work in trauma, the field of trauma, much more effectively, because even though they're in a normal state of consciousness, that window of tolerance is open, much more open than it is in their normal waking state. At higher doses, ketamine is definitely psychedelic. It provokes a non-narrative state of consciousness, but at the doses that I'm using, people are still conscious. They are definitely drowsy and altered, but they are not to the point that it would be used in an anesthesia sort of setting. And again, very, very appropriate for therapy, but it is a non-directed, inner guided, inner wisdom sort of psychotherapy. So much more like a psychedelic sort of therapy. And then at further doses, it's more of an anesthetic. So just illustrating this a little bit better, at a very low dose, people are still alert. They're not in a non-ordinary state of consciousness. And that would be like around a 0.1 milligram per kilogram sort of dose. At a little higher dose, 0.5, they sort of get a little dreamy, a little floaty. They may begin to dissociate, which means depersonalize or derealize, which means depersonalization is when you feel like you're no longer in your physical body. Derealization is when things around you seem unreal. So at about 0.5, they may start to dissociate. And there's some evidence that dissociation is sort of the important thing for using it psychotherapeutically. So we oftentimes will shoot for a sweet spot where we get somebody to dissociate at the minimum tolerable dose of ketamine so we don't provoke too many side effects. So that's kind of more that dreamy state. And as you get to higher doses, it becomes profoundly psychedelic. Some people will end up in a K-hole at a closer to, like, I'll say 0.7 to 1 milligram per kilogram. And when you get up into a range of about 5 milligrams per kilogram, assuming it's used solo in an anesthesia sort of setting, it's definitely lights out. So that's how it works. It takes about 2.5 hours. That's the half-life of ketamine. So about 5 half-lives to eliminate its dosing. And as a result, for about 10 to 12 hours, ketamine will still be in your system, even though you had the drug many hours before. As a result, when someone comes to me for a ketamine session, they cannot drive home. They also can't make any major decisions, no medical decisions, no life decisions, no operating a heavy machinery. And that's because I want it to be out of their system before they're doing anything that can be dangerous. Ketamine is the most mercurial molecule I have ever seen. At the same dose, the same setting, the same everything. I will set people up exactly the same way, same playlist, same everything. And you think you're going to get the same experience. No, the experience is always different. And I don't know why that is. So mercury, I don't know if when you were a kid, you played with mercury. We was always really excited when the thermometer broke. We pull it out and put it on the kitchen table and splat it into a million pieces and bring it all back together. Like, what were we thinking?
Excuse me, mercury is a very toxic substance, but that was kind of common things that we did way back then. And just in that same way that mercury can kind of change form and be liquid, be solid, goes in the gas phase really easily, ketamine is like that. It changes how it works so much with different people in different settings, or even with the same setting. So people can have an experience that's incredibly challenging or incredibly ecstatic, or it can be both during that same experience, that same ketamine session. Most people describe the experience as being ineffable. And in other words, there's absolutely no words to describe what happens, as is often true with other psychedelics. In using ketamine, there are some contraindications. And even before we ever begin to work with somebody with it, we have to do a full medical and a full psychiatric evaluation. You also need to have a diagnosis if you're going to use it legally. In the psychiatric setting, people can't just be using it for giggles and grins. There are a lot of retreats that are offering it in that format. It's really not legal to do it that way. So use caution if you attend that sort of thing, because you really do need to have a diagnosis. But most people do have a diagnosis of anxiety or depression or trauma. This is a pretty difficult world in which we live these days. But so you need to, like I say, have a diagnosis before you can proceed with ketamine therapy. So contraindications would be things like you can't consent. You're not psychologically or mentally capable of consenting. You have an allergy to ketamine. You have an active substance use disorder, although it is used for the treatment of substance use disorder. So take that particular contraindication with a grain of salt. There are physical contraindications: uncontrolled high blood pressure, uncontrolled hyperthyroid disease, glaucoma, things like that. And psychological conditions like psychosis or schizophrenia are definite, pretty much rule outs for using ketamine. Although I have seen it used in psychotic people and very effectively. So again, grain of salt, need to go to a provider that's very familiar with its use. It also has a lot of side effects. And so they're pretty safe in terms of their things, but it absolutely will raise blood pressure. They always say it's like 20 to 3 millimeters of mercury raising. So you're systolic. If you're starting at 100, they say it'll go up by 20. So to 120, 130. I think that's a bunch of BS. I see people routinely have their blood pressure increased by 50, and I'm not giving whopper doses or anything either. So something you have to be very careful that you're looking at blood pressure and you're making sure that people have well-controlled blood pressure. If they're coming in and their blood pressure is 150 or higher, I won't give it to them without first treating their blood pressure and getting them down in a lower range in case they have that blood pressure increase of 50 millimeters of mercury. Your heart rate typically will increase a little bit too. Not everybody, most people, a little bit. And also, people can get changes in their heart rhythm, although I've honestly not witnessed that, but it is possible. GI wise, it can provoke nausea. So people who have a history of motion sickness disorder, I always pre-treat with meclizine, which is basically Bonine over the counter, is one way of getting that. Or maybe Zofran during a session just to help with the GI distress. Not that common, but it is possible. People with bladder conditions, it's not really a good idea because it can provoke bladder problems, especially if used in very high doses on a long-term basis, which again is not how we use it, but people who are abusing it in high doses long-term can get problems with their bladder. And it can provoke an increase in intraocular pressure. So people with glaucoma, not a good use for that. Neurologically, definitely causes some dizziness, definitely profoundly altered perceptual changes, that people might get nystagmus, which is where your eyeballs get kind of wiggly. All of these things revert once the session is over. So it's a relatively short-term effect of all of this. And again, for people with psychosis, you really wouldn't want to use it, or people who have a family history or strong tendency toward possible schizophrenia, probably not a good drug of choice for those individuals. A lot of people don't think it causes respiratory depression, and in lower doses, it typically does not, but it is capable of doing that, especially at higher doses. So ketamine has a lot of benefits for anesthesia, for analgesia, as an antidepressant, and for a lot of other psychological, psychiatric conditions. It does indeed cause dissociation, especially at around that 0.5 milligram per kilogram or higher doses, and it can open the window of tolerance. We also know that it has, like other psychedelics, a lot of other benefits. So it's an anti-inflammatory, it increases neuroplasticity, motivation, and suggestibility, and does cause brain changes. It increases the level of BDNF. And a woman whose name is Guldalan, who has done a lot of work with a lot of the psychedelics, she was the first person who looked at MDMA in octopi. Normally, you put two octopi in a tank and they don't want anything to do with each other. They sit at the other side of the tank and they are total mitts off, don't come near me, very standoffish. She gave them MDMA in a very classic study, and it was a total cuddle puddle. Those octopi could not get enough of one another. So that's interesting information studied in other species with regard to these psychedelics. She's looked at psychedelics, ketamine, psilocybin, all of that in mice, and found that window of learning, that window of opportunity for ketamine in mice, again, appropriate probably, or probably relational to humans in terms of relatively speaking. So that window of opportunity for learning is open for about 3 days in mice. And she's now studying it for stroke patients, because a lot of stroke patients that didn't get proper, I'll just say, remediation during that immediate window following a stroke, now they're looking at it to use ketamine to reopen that window of learning. So like when you're 7 years old, you learn a language, or under that age, you can learn a language really easily because you're open. That window of learning is really open. Ketamine has some of those same effects, as do a lot of the other psychedelics. So,
You have about 10 minutes, by the way.
what?
You have just a couple of minutes left.
Okay, and I'm almost done. So I will run through the rest. So as I said, it's used for all of these different conditions. And again, you really need to think about doing preparation. You set an intention, although your intention will not necessarily be realized. You want to be really clear about your set and setting, the music, the touch. I monitor people throughout the entire experience. I hold their hand, and I have them, again, set an intention, but have them hold it loosely because they may not realize it, and plant a flag for ordinary consciousness using their auditory, visual, olfactory, gustatory, and tactile senses to bring that journey back into their normal state of awareness, because they can revisit the experience at a later date utilizing these methods. And the set and setting, I make sure that they're in a positive mindset before they enter. I get them into a state where they are in total trust so they can completely let go. The setting is completely cleansed. It's very clean. It's very clear. I cleanse it not only physiologically with, wipes and things like that, but also with rattles, drums, and sprays. I have them go inward on a recliner with a blanket. I use eye shades. It's very private. I usually use headphones, which is why I wear these crazy headphones, and it's a very safe environment. Music, as many psychedelic journeys, is incredibly important. It's usually without words and lack of familiarity, so they don't anchor to it, and have a specific playlist for each particular individual. The session, I provide reassurance, I hold the space, I keep them protected, and I harvest whatever is received in this journey in that following hour after the ketamine has begun to wear off. I call it the golden hour. I record everything so that I can provide that information to their long-term psychedelic therapist, who's somebody hopefully who's also psychedelically savvy, so they can take that into their sessions and integrate their learnings into their everyday life, because that's really the goal, is to integrate the information, that the insights that are gleaned. And integration may be a long-term process. It may take a lifetime. It's really important to integrate the information that you get out of every psychedelic journey. Thank you so much for your kind attention today. And if anybody has any questions, I'll be happy to do my best to answer them. And here's some references. So not extensive, not complete by any stretch, but at least some references. All righty.
All righty.
That was absolutely incredible. Wonderful. Thank you so much. Clearly, you are so knowledgeable about that area. I'd love to schedule you another morning so that we would be able to have you with interaction with everyone.
That would be lovely. Thank you so much. I really appreciate your kind words.
Sure, absolutely. We really appreciate you. I felt badly that we have to cut things short, but we do. But I will
No worries.
email you to reschedule you for another time. Thank you so much.
You're so welcome. Thank you. And thanks for sharing about the toad.